Learn about the county's model healthcare plan, convenient family clinics, children's programs, neighborhood and senior centers, transportation services, and more.
Welcome to Hillsborough Health, a series that lets you know about what services are available to county residents. Today's show will be about the Sunshine Line. I'm Joe Touger, and today our guests are William Ramos, who's the Customer Service Supervisor for the Sunshine Line, Scott Clark, the Sunshine Line Manager, and Felicia Piechowiak, the Operations Supervisor for the Sunshine Line. What is the Sunshine Line?
Sunshine Line is a county agency that provides door-to-door transportation service and bus passes for the transportation disadvantaged in Hillsborough County. We do this as part of a coordinated service with HART and Medicaid Transportation and other agencies that provide transportation or fund transportation for their own clients, such as Hillsborough Health and Aging Services. And as part of the coordinated service, Sunshine Line provides service outside of the HART area. If there's someone who's transportation disadvantaged and they live within the HART area, that's where they would probably qualify for our bus pass program.
So aside from where they live, what other qualifications do you look for to find if someone is going to be eligible to participate in the Sunshine Line?
Well, as part of the state funding, the definition of the transportation disadvantage would be seniors, people with disabilities, and people with low income. And when people call Sunshine Line at 813-272-7272, we have our customer service agents would screen them for eligibility.
And when you say senior citizens, how old would the individual need to be in order to qualify?
For Sunshine Line service, they would have to be at least 60 years old.
Okay. Now, William, tell us, how does someone who wants to participate and receive service from Sunshine Line, how do they go about doing that?
Hillsborough County residents can call the 813-272-7272 number, and we have agents available that will screen them through the process and find what transportation are they eligible for.
And is the service available in Spanish as well as in English?
Yes, they are. We have agents that speak English, and we have agents that speak Spanish.
And if someone is a caregiver for someone, is that person also eligible to participate in the program as a co-rider or as a passenger along with their either mother or father or the individual that they care for?
Yes, they do.
And now towards Felicia, what kind of programming or what kind of state-of-the-art facilities or programs do you have that enable you to schedule so many different riders across the county?
Well, we have a software system where when the customer calls, the agent will automatically schedule the trip, and the software will place it on the vehicles that we have. And then we have, I have 3 dispatchers that they schedule and dispatch, and they review those routes to ensure that the clients are on the correct vehicle.
And where can Sunshine Line take individual riders? What types of appointments qualify for the Sunshine Line service?
Mainly medical appointments, grocery shopping, things like that people would need to sustain life, dialysis appointments, and different things like that. We're not at the point where we're taking people to recreation trips, senior functions, we take clients to also.
And what are the hours of operation?
We work Monday through Friday, 7 a.m. to 5 p.m.
And so if, say, someone needs to make an appointment for the service, are those the hours they would call between?
The call center hours would be 8 a.m. to 5 p.m. Okay. And we're closed for lunch from 12 to 1.
And when you say that they're available between 7 and you said 5 p.m., is that right? Is that when your last pickup happens, or do they have to be back at their home at 5 p.m.?
Joe, that's a good question. Our vehicles, they need to be parked back at their yard by 5 p.m. So our last pickup would probably be around 4:15 to take people home and to get the vehicles back to their parking areas.
And are services available not so much for pickup, because we know that the individual riders have to be outside the Heartline area of service, but how about where the appointments are located? Can that be anywhere within Hillsborough County?
For us, yes. Sunshine Line covers the whole 1,000 square miles. We provide approximately 700 trips a day, covering from Beesville, Waimama, New Tampa, Town and Country, Carrollwood, South Tampa, the whole 1,000 square miles. We provide door-to-door transportation service.
And how long has Sunshine Line been in operation?
We've been in operation since the 70s. And back then, it was a social services organization consisting of 2 drivers using their own cars and a pager.
We've come a long way, haven't we, Scott?
Oh, yes, we definitely have.
In terms of how many people, your ridership, how many people do you all take care of every year?
We have over 4,000 clients a year.
And are those individuals that are regular riders or one-time, single-time riders?
Those would be the door-to-door and bus pass, and they ride multiple times.
And I'm glad you brought up the door-to-door, Scott. As I understand it, Sunshine Line will actually drive to your doorstep and pick you up and take you to your appointment. Is that right?
That's right, Joe. When we're dealing with people with disabilities, they have a difficult time to maneuver and to get from their residence to the vehicle. So our drivers will actually park the vehicle, walk up to the door, introduce themselves, and provide assistance. All our drivers are trained on providing mobility assistance and assist them to the vehicle, onto the vehicle, and even help them with their seatbelts.
Right. Now, for security reasons, are your drivers identified when they, or do they identify themselves when they come to the door? How can the riders know that the person coming to the door is a Sunshine Line employee?
Another great question. All our drivers have uniforms and a county ID badge. And as far as security, all of our drivers, they pass a level 2 security background check.
Excellent. In terms of a rider who needs that little bit of extra help, what kind of help is the driver able to provide for that special needs rider that may be handicapped or elderly?
The driver actually goes to the door and will assist the client to the vehicle, and then they will help them onto the vehicle. We do have wheelchair lifts, so if a passenger can't use the stairs on the vehicle, they can ask to use the lift, and the driver will allow them to, they'll put them on the lift and take them inside the vehicle.
So when you say full service, you really mean full service?
Yes.
Yes.
Now, how does the process for pickup work as far as when the individual riders are dropped off at their appointments? How does the driver know when to come back and get them? Because we all know that doctor's appointments can sometimes go a little long.
We provide this service, so we ask them what time do they think that they will be finished. Typically, it's about an hour and 2 hours after their initial time for the appointment. Now, we do also prepare our people that if there is going to be running early or it's going to be running late, they should call and let us know so we don't have the driver. We'll make adjustments so they can be picked up at the time that they need to.
Does the individual rider then need to have a cell phone, or do you provide them with a number that they could call, say from the doctor's office, to let you know that they're going to be running a little late?
Yes, we provide the 813-272-7272 number.
Wonderful. Now, we discussed that they are able to use Sunshine Line to go to, say, doctor's appointments, but we also talked about grocery shopping. Now, do the drivers actually help with the grocery shopping as well?
Yes, they do. Depending on the person's needs, what we ask is that people pick up what they can safely carry. And the drivers will assist them depending on their needs, but our drivers are only allowed to make one trip. Because they have other people in the vehicle, they can't keep going back and forth from the grocery store to the vehicle. So we ask people what they can safely carry. And of course, our drivers will assist them and what they can safely put within their seating area. Because it is a shared ride service, we don't want to impede other passengers or cause a safety hazard with groceries all over the aisleway and a tripping hazard and things like that. So it's what they can safely carry and put within their seating area.
And Scott, I'm glad you mentioned that. About how many riders can be on each individual trip?
We have several different types of vehicles, and our scheduling software helps us with that, different capacities, from 7-passenger, 8-passenger, 10-passenger, and 12-passenger, along with a wheelchair space. Most of our vehicles can fit 2 to 3 wheelchairs.
And as far as the types of riders, do you mix them? Say some are going grocery shopping and some are going to doctor's appointments, or do you have the grocery bus with the doctor's van? How does that break up that way?
It is a shared ride, and it's based on location, because we like to get as many people on the bus at one time as we possibly can, and to help reduce costs so we can be more efficient. For instance, if we have a shopping group in South Tampa and we have a person in South Tampa that's going to the doctor heading the same direction, we're going to pick them up together if there is vehicle capacity, and they ride along as a shared ride.
Now, in terms of being screened, William, this may be more of a question for you, since you discussed earlier about how the individuals that answer the phone will conduct a screening process. What are some of the questions someone can expect to receive from the screeners when they call Sunshine Line?
It will be really easy if they provide with the really basic information. Obviously their name, date of birth, social security number, information along those lines, household income. That's information that we need in order to be able to provide them with eligibility.
Now, are you able to make the decision right away and let the caller know that they can, in fact, participate, or is that something where they would get a call back at another time? Most
cases, we are able to actually screen them and provide them with service on the same day. If it's easy enough, we are able to book their trip on the same day that they call.
Well, obviously, we always have to get to the brass tacks of things, and cost. What cost is there to your riders to use the service?
Oh, depending on the household income, some of them are able to not have to pay anything, but there are certain circumstances where they have to make a copay, and that is no more than $5 a trip.
And would that be for each leg of the trip, or would that be for the
entire round trip? It will be for each leg of the trip.
And so at most a maximum of $10 for this kind of service. That's great. The issues that can sometimes present themselves is with people that sometimes have doctor's appointments because they're not 100% healthy, and they may get sicker before they have to go to their appointment. Is there a mechanism by which they can cancel their appointment to be picked up by the Sunshine Line?
As a matter of fact, we had a case like that the other day in which somebody called and said that they were really sick. We did ask them to call 911, but they do call the 272-7272 number.
And so they can, in fact, cancel their ride without incurring any cost?
Yes.
As long as that is within an hour of their trip, because we don't want to send the vehicle there and then they cancel at the door, because that does cost money. And that would fall within our no-show policy, which if someone schedules a trip and the driver shows up and they don't go, that would be a no-show. 3 no-shows within a 30-day period, they would be suspended for 30 days.
In terms of then the initial screening that goes into determining who's eligible to participate in Sunshine Line, is that screening process updated, or once you qualify, you qualify?
That is updated every 2 years, and depending on funding agencies, it may be more or less time. Because we also, other agencies like Hillsborough Health, Aging Services, they purchase transportation from us, and they might have stricter criteria where they need eligibility updated annually.
Okay, and on that note, Scott, we're going to take a break, so we'll be back shortly. Welcome back to our show about the Sunshine Line. Scott, we had left off before the break talking about some of the areas that you service. So I'd like to ask you a question about what if someone doesn't qualify for Sunshine Line? What options are there if they would qualify under another of the county's programs?
That's a great question, Joe. If they don't qualify for Sunshine Line, our customer service agents, they screen them for other transportation options that would be available within the community, including HART, Medicaid transportation, or other agencies, private agencies, things of that nature. Then talk about HART, if they are within the HART service area, and we talked about bus passes before, If they can't afford the fare for the HART bus, they can call Sunshine Line and we'll screen them for eligibility. And if they qualify, we are able to send them a one-day bus ticket to ride the bus. And some organizations and programs, and if they have multiple appointments for counseling or different things like that, we're sometimes able to send them a 31-day bus pass for transportation service. Now, for transportation outside of the bus area, then that's when Sunshine Line would probably be able to provide that transportation. If they are full Medicaid, the Medicaid transportation provider would provide transportation to their medical appointments. If they're outside their Medicaid and outside of the bus route, and they're going to, say, the pharmacy, Medicaid transportation won't cover that. That's where they would call Sunshine Line, and we would be able to most likely provide that transportation for them.
And William, if someone is being picked up by Sunshine Line, what types of identification or what paperwork do they need to have with them when the driver comes to their door?
Actually, since we have screened them prior to us getting there, they would not need any identification to show any of the drivers.
And now, Felicia, this question's for you. What happens if one of the vehicles breaks down?
The driver will contact our dispatch office, and they will ask, they look to see, are there clients on board? And then we dispatch another vehicle, and if the vehicle has to be towed, they schedule that as well.
So even with the breakdown, you still have a contingency plan in place to get your riders to their appointments?
Yes.
Fantastic. Now, what happens if a rider is done early with their appointment? We talked about them going late, but what happens if they're done early?
All they have to do is the customer would call the 272-7272 number and let them know that they're already early. And then we look to see if we have availability to take them back home early. And if not, then they would need to wait for their scheduled return time.
If in fact you have a rider that does not speak English perfectly well, is there a mechanism, or do you have some type of multilingual translation in place for some of our riders that may not be as fluent in English as they'd like?
I'll be able to answer that, Joe. Yeah, each driver has a push-to-talk handheld radio with them. So if the driver didn't speak Spanish or another language, mainly Spanish, because we have bilingual employees in dispatch, operations, and in the customer service, they would be able to talk over the phone to someone in the operations center and get their needs translated, and then we would relay that to the driver.
And does the Sunshine Line have a, say, customer service number or customer service representative that's able to take particularized needs and take into account particularized needs? Say, for example, if someone has a motorized scooter, we talked earlier about wheelchairs, but some of your riders may actually use scooters to get around. Is that something that the Sunshine Line can, in fact, accommodate?
That's actually part of the questions that we have during our eligibility process. We do ask them whether they are wheelchair bound or they use a walker, or in this particular case, a scooter, so we can accommodate in our appointment setting.
Now, I know from personal experience that many of the elderly like to have a companion, and we did discuss earlier about the fact that you can bring with you a companion or a co-rider. What would be the process for getting a co-rider or a companion screened to be able to participate with the actual participant in Sunshine Line?
Well, there are two things there. There's an escort, which is a medically necessary escort. That we would need to get a form or a letter on file from a doctor saying that this individual needs an escort to take care of them during the trip, because our drivers aren't trained to be care providers. We're trained to drive the vehicles and to provide assistance. But passengers need to be able to care for themselves during the transportation or bring an escort. And at the time they book their trips, they would need to let the customer service agent know that they're bringing an escort. If they have one approved. If not, they need to get the letter from a doctor or a medical provider, send it to Sunshine Line or fax it to Sunshine Line so we can put that in their file. There's also the second part was extra rider or an additional rider. Say there's a single mom and she has her child and she has to go to the doctor and can't leave the child home alone. At the time when she books her trip, she will have to let the customer service agent know, yes, and I'm also bringing an extra rider with me, and we can accommodate if we have space available.
What about service animals? If you service anyone that requires the use of a service animal to help them get around, can Sunshine Line accommodate that as well?
Yes, and again, when they book their trip, they need to let us know that they do have a service animal.
Now, when you call the number for service to see if you would qualify for participation in Sunshine Line, is there a actual person that answers the phone, or do they have to go through the inevitable, in many cases, push 1-4, push 2-4? How does that work?
We'll let William answer that question.
Actually, there are options within the phone number, which it will point him in the right direction. We have cancellations, and we have to set up appointments.
But eventually they'll talk to a live person,
Yes.
right? Okay.
It goes into a queue based on a number of calls. Sometimes we can get up to 800 calls a day, and we only have limited employees, so they do go into a queue. Some days there's a longer wait than other days. And so in that case, if there is a long wait, if they call back the next day or at a later time, they can usually get through.
So riders should not be discouraged if when they call they have to go through a various menu option. Eventually they're going to get to the person that needs to be there to help them. How far in advance would you recommend someone call Sunshine Line in order to make sure to increase their chances that there is going to be some availability to transport them to their appointments?
No earlier than 7 days prior to their appointment. We do, on a case-by-case basis, depending on the situation, we might be able to book a trip within that same day, but those are a little harder because of the availability within our operations.
Now let's talk about what might be hopefully not a frequent occurrence, but something that may in fact happen. If someone has a 3 o'clock appointment with their physician, and we all know that sometimes doctors' offices don't get done on time or don't take people in on time, and it's looking like the appointment is going to run past the point where you're able to pick up the individual and have your vehicle back by the certain time at your location. What should the rider do if that scenario comes to play?
That's a great question, Joe. They should call us immediately. Once they realize that they're not going to be done on time, that way we won't send the vehicle there and we can make different adjustments. The individual could then call a family member or somebody like that to see if they can arrange other transportation. If they have no other means and they're going to be stranded there, they need to let us know, I have no one else to come pick me up, and we will make adjustments. We will not leave people stranded, especially seniors, elderly, people with disabilities at their doctor's office. We will do everything we possibly can to get them home safely.
It sounds like this is such an excellent service for the elderly, senior citizens, and economically disadvantaged in our community. Are there any other facets or factors of the program that we haven't touched upon that you'd like to stress to our viewers today?
Well, one of the things I'd like to say is our drivers training. All of our drivers, they have to come on board with 1 year experience. Then they go through a 3-week training course in disability etiquette, customer service, operating the vehicle, wheelchair securement, how to load the wheelchairs onto the vehicle, how to secure them properly down to the vehicle so the clients are safe. We strive on customer service. Our customer service rating for the past 2 years has been 99% from an independent organization that did the survey. And we just strive to meet the needs of our Hillsborough County citizens.
And is there a manner in which, if someone is considering using Sunshine Line, that they could obtain information about the program online?
Yes, Joe, they can go to the county website, which is listed, and it's www.hillsboroughcounty.org. And they'll be able to find a link to Sunshine Line on that website.
And do you have any programs in place that will enable folks to look at Sunshine Line and in the future maybe even book their appointments online? Is that something that you guys are looking towards doing in the future?
That's another great question. That's something that has been on my mind and the county as a whole is innovation. And hopefully someday we will be at that level. We're not there now. And looking at the people that we serve, the senior citizens, which make up probably 70% of our clients, they're really not with all the computer technology as others would be. But we are looking into that in the future, and that would be great to be able to book trips and cancel trips online.
Yeah, my mom, she's a senior citizen, and I know that sometimes I have to help her with various medical appointments and so forth. And so I try to do as much as I can online. So for the caregivers or the responsible child that looks after the parent, yeah, I think that that's a very worthwhile goal, and it's good to hear that the county is looking towards innovation and moving in that direction. So any closing thoughts or comments that you have for our viewers about the program? William?
Well, we're here to serve, so it'll be a pleasure to meet the people of the county and provide them with the help that they need.
And Scott?
I'd just like to thank all the individuals that do use our service, and we strive to meet the needs of the transportation disadvantage of Hillsborough County, and I'm hoping that we'll continue to do that long into the future.
And in fact, before we move past that, Scott, are there any plans in place for the expansion of the program? Areas that you're thinking about possibly extending it? I know you said earlier maybe senior citizen events or meetings or whatnot.
Yeah, there are no plans right now for expansion, but you know, the future is what it is, and we'll see what happens. It is all based on funding, you know, and we're funded by the county, by state, and by other organizations. And to increase service means you need increased funding.
Isn't that the truth for most everything?
Yes.
So, and Felicia, any closing comments you have for our viewers?
I'd just like to say that this is a very needed service, and we do love what we do.
Yes.
And all of our clients, you know, we do love serving our clients of the Hillsborough County.
And speaking of, how many people are on that team that love to serve the citizens of Hillsborough County?
Altogether, I think we have about almost 80 now.
71.
Yeah, 71. We've lost quite a few here.
Well,
lately.
are you hiring? So.
I don't think we're hiring right now, maybe drivers, but yeah, we're about 71.
Well, that sounds like a good team in place, and that's across the board, from drivers to management to coordination and all aspects of the program.
You know, it is a really needed service in Hillsborough County, and I really appreciate the county commissioners and the county administration for supporting this program.
Well, Scott, some wonderful words there. Thank you so much for being here today. Today, we've had the opportunity to meet with William and Scott and Felicia from Sunshine Line. I'm Joe Touger, and thank you for joining us on Hillsborough Health.